Most people think falls are just an unfortunate part of aging, a simple loss of balance resulting in a bruise or broken bone. But what many don't realize is that specific ear symptoms often predict dangerous falls. Medical research has discovered that inner ear problems dramatically increase fall risk, yet many seniors dismiss these warning signs as normal aging. What's truly alarming is that falls aren't just about broken hips. They're the leading cause of injury-related deaths in adults over 65. According to research, up to 35% of adults over 40 experience vestibular, inner ear balance, problems at some point, and adults with inner ear dysfunction are up to 12 times more likely to have a serious fall. But here's the hopeful news. When these ear symptoms are properly addressed, the risk of falls can be significantly reduced. So if you or someone you love has been experiencing dizziness, feeling unsteady, or has already had a close call with falling, stay with me until the end of this video. The information I'm about to share could literally save a life. If you're finding this information valuable, please take a moment to subscribe to our channel. We share new, potentially life-changing content every day, and your support helps us reach more people who need these solutions. Now, let's begin with a story that could be happening in any home, including yours. Ray Jenkins clutched the kitchen counter with white-knuckled hands, waiting for his world to stop spinning. At 72, the retired electrician had managed to hide these dizzy spells from his family for nearly 8 months. Just a little lightheadedness, he'd tell himself. Probably my blood pressure medication. This morning was different. The room wasn't just tilting. It was violently whirling, leaving him nauseated and terrified. His granddaughter found him 30 minutes later, still frozen in the same position, afraid to move even an inch. "Grandpa, what's wrong?" she asked, alarmed by his ashen face. "Just resting a bit," he lied, forcing a smile. But as he finally released his grip on the counter to reassure her, his balance evaporated completely. Ray crashed to the floor, his hip shattering on impact. What followed was catastrophic. Surgery, complications, pneumonia, and finally, heart failure during his 3rd week in the hospital. All stemming from a simple ear symptom he dismissed as insignificant, a symptom his doctor later said could have been successfully treated in a single office visit. You clicked on this video because you saw our thumbnail, Seniors Over 70, Your Ear Symptom Predicts Deadly Falls. Perhaps you've experienced brief moments of dizziness yourself. Or maybe you've noticed a loved one seeming unsteady, holding furniture for support, or becoming reluctant to leave home. These aren't just inconvenient signs of aging, they're potentially life-threatening warnings. What Ray experienced, and what millions of seniors are experiencing right now, was a deterioration in his vestibular system, the delicate balance mechanism housed in the inner ear. This intricate system consists of fluid-filled canals and specialized cells that tell your brain exactly where your body is in space. When this system begins to fail, the consequences extend far beyond occasional dizziness. Maria Gonzalez, a 67-year-old retired nurse living on a fixed income, noticed her first symptoms while gardening. "I thought it was just from standing up too quickly," she recalls. "Then it started happening when I turned my head in certain directions." 6 months later, a fall down her front steps resulted in a traumatic brain injury that permanently affected her speech and mobility. What makes this particularly tragic is that Maria, with her nursing background, would have immediately recognized these symptoms as serious in any patient under her care. But like so many seniors, she applied a different, more dismissive standard to her own health changes. The inner ear symptoms we're discussing aren't rare. Studies show that up to 40% of adults over 65 experience significant vestibular dysfunction. For seniors, falls are a highly prevalent event with 1 in 3 community-dwelling adults age 65 or older falling each year. Studies found that vestibular impairment was present in 80% of seniors who experienced multiple falls, compared to only 18.75% in non-fallers. Yet many never report these symptoms to their physicians. Some remain silent out of fear that acknowledging the problem might threaten their independence. Others assume dizziness is simply an inevitable part of aging. And many don't realize that what they're experiencing is actually a medical condition with specific, often highly effective treatments. For Clarence Washington, a 74-year-old retired school janitor living in public housing, the cost of medical care led him to ignore his symptoms. I kept telling myself it would pass, he explains. I couldn't afford to see specialists for something that seemed minor. His eventual fall resulted in months of rehabilitation that cost far more than the treatment would have, both financially and in terms of his independence. What happened to Elaine Park could happen to anyone ignoring inner ear symptoms. At 69, the successful real estate broker had been experiencing occasional vertigo for almost a year but kept her schedule packed with showings and open houses. I just took motion sickness pills and pushed through, she admits. During a property tour, a severe dizzy spell struck without warning. She fell down a full flight of hardwood stairs, suffering a catastrophic brain hemorrhage that left her in a coma for 11 days. Elaine survived, but many seniors aren't as fortunate. Falls are the leading cause of injury-related deaths in adults over 65, with over 1 in 3 community-dwelling adults age 65 or older falling each year. What many don't realize is that the most dangerous falls, those resulting in head injuries or major internal bleeding, often happen to people experiencing acute vestibular episodes where the world seems to suddenly spin or tilt. Dr. Michael Chen, a neurologist specializing in vestibular disorders, explains, during these episodes, the brain receives conflicting information about the body's position. It's not just minor unsteadiness, it's profound disorientation where the person cannot tell up from down. They don't just stumble, they completely lose spatial awareness, often falling directly backward without any protective reflexes. These falls without protective reflexes explain why vestibular-related falls are more likely to result in serious head injuries compared to falls from other causes. The person doesn't extend their arms to break their fall. They simply drop, often striking their head with full force. For Warren Miller, a 77-year-old retired factory worker with limited healthcare access, this type of fall proved nearly fatal. I was alone when it happened, he recounts. 1 minute I was fine, the next everything was spinning and I was on the floor, bleeding from hitting my head on the coffee table. Warren lay on his floor for nearly 7 hours before his daughter found him semi-conscious. What makes these incidents particularly tragic is that the underlying vestibular disorders are often highly treatable. Jennifer Wong, a 68-year-old elementary school teacher, experienced progressive dizziness for months. Unlike many seniors, she reported her symptoms promptly. My doctor identified something called benign paroxysmal positional vertigo, BPPV, and performed a simple positioning maneuver right there in the office. The relief was immediate and almost miraculous. BPPV, benign paroxysmal positional vertigo, is the most common vestibular disorder in seniors, involving calcium crystals in the inner ear becoming dislodged and sending false movement signals to the brain. It affects nearly 10% of people over 65 but is diagnosed in less than half of cases because patients either don't report their symptoms or doctors don't recognize the pattern. Before we continue with these life-changing solutions, if you're finding this information helpful, please take a moment to like this video and subscribe to our channel. We share new content like this daily, and your support helps us reach more people who need these solutions. The warning signs of serious vestibular problems that demand immediate medical attention include the dizziness that suddenly worsens or changes in character, episodes that last longer than a few minutes, any dizziness accompanied by hearing changes, a vertigo that consistently occurs with specific head positions, balance problems that interfere with daily activities, any falls, even if they don't result in injury. Sandra Williams, a 71-year-old community volunteer, noticed something peculiar months before her fall, increasing difficulty multitasking. I couldn't walk and carry on a conversation simultaneously anymore, she explains. And noisy environments became overwhelming, like my brain couldn't sort the important sounds from the background. Her doctors initially suspected early dementia. The actual diagnosis, vestibular dysfunction, came only after her serious fall. This connection between inner ear function and cognitive performance represents one of the most overlooked aspects of vestibular health. The vestibular system shares numerous neural pathways with brain regions responsible for spatial awareness, memory, and executive function. When the brain receives confusing balance information, it diverts substantial cognitive resources to simply maintaining equilibrium, leaving fewer resources for other mental tasks. This explains why many seniors with undiagnosed vestibular problems report symptoms that mimic cognitive decline: difficulty concentrating, memory lapses, mental fatigue, and inability to perform multiple tasks simultaneously. Research has found a significant association between vestibular dysfunction and reduced cognitive performance in older adults. For Howard Jackson, a 68-year-old retired high school principal living on a teacher's pension, these cognitive effects proved professionally devastating. I was serving on several community boards after retirement, but I started having trouble following discussions in meetings. I'd lose my train of thought mid-sentence. People assumed I was developing dementia, and I feared they were right. After a minor fall prompted vestibular testing, Howard discovered the true cause. With appropriate treatment, his cognitive symptoms improved dramatically within weeks. Beyond cognitive effects, untreated vestibular disorders create another insidious problem: social isolation. Judith Klein, a 73-year-old widow living in an upscale retirement community, gradually withdrew from activities she once enjoyed. The dizziness was unpredictable, which made it frightening. I stopped going to my bridge club because the card movements triggered symptoms. Then I stopped attending concerts because the crowds made me feel unsteady. Eventually, I was barely leaving my apartment. This isolation accelerates both physical and cognitive decline while increasing depression risk, a combination that further increases fall probability. Research shows that socially isolated seniors have a higher risk of falls compared to those maintaining regular social engagement. What makes vestibular symptoms particularly confusing is their seemingly disconnected nature. James Porter, a 76-year-old retired postal worker, experienced unusual anxiety in grocery stores and shopping malls for months before connecting it to his balance system. "I thought I was developing panic attacks. Turns out, the visual complexity of store aisles and the patterned floors were triggering my vestibular disorder." For those experiencing these symptoms, understanding the connection between inner ear function and brain performance offers important hope. Treating the vestibular problem often improves cognitive symptoms that may have been incorrectly attributed to irreversible brain aging. Earl Robertson, a 74-year-old retired construction worker, dismissed his intermittent dizziness for over 2 years. "I figured dizziness was just part of getting older, something you live with, like gray hair or reading glasses." This common misconception nearly cost Earl his life when a severe vertigo episode struck while he was at the top of his basement stairs. The belief that dizziness and balance problems are simply inevitable aspects of aging represents perhaps the most dangerous misconception among seniors. While certain vestibular changes do naturally occur with age, significant dizziness, vertigo, or balance impairment is never normal. These symptoms always indicate a specific problem that deserves medical attention, and in most cases, effective treatment. Another dangerous myth involves the effectiveness of treatment. Margaret Chen, a 70-year-old former elementary school teacher, delayed seeking help because she believed nothing could be done. "My sister had similar problems years ago, and her doctor just told her to be careful. I assumed that was still the state of treatment." When Margaret finally consulted a specialist after her second fall, she discovered that vestibular rehabilitation therapy could dramatically improve her symptoms, something unavailable when her sister experienced similar issues decades earlier. For Richard Diaz, a 65-year-old landscaper still working to make ends meet, financial concerns created another barrier to treatment. "I don't have great insurance, and I was worried about specialist costs." What Richard didn't realize was that many effective vestibular treatments, particularly for BPPV, the most common cause of vertigo in seniors, can be performed in a primary care setting at minimal cost. His eventual fall resulted in hospital bills far exceeding what treatment would have cost. Perhaps the most insidious misconception involves the fear that acknowledging balance problems will threaten independence. Patricia Okafor, a fiercely self-reliant 77-year-old immigrant who built a successful small business, hid her symptoms from her adult children for this exact reason. "I was afraid they'd decide I couldn't live alone anymore." The irony is that her eventual serious fall accomplished exactly what she feared, a lengthy rehabilitation followed by her reluctant move to assisted living. The truth Patricia and many seniors miss is that properly treating vestibular disorders typically enhances independence rather than restricting it. With appropriate intervention, most seniors experience improved balance confidence that allows more activity with less risk. Self-assessment represents a critical first step for those experiencing potential vestibular symptoms. Consider these questions. Do you feel unsteady when walking on uneven surfaces? Have you reduced activities because of balance concerns? Do you experience dizziness when moving your head quickly? Do certain head positions trigger spinning sensations? Do you feel less steady in the dark or in busy visual environments? Have you noticed increased difficulty with multitasking while moving? Answering yes to even one of these questions warrants discussion with a healthcare provider. Answering yes to multiple questions suggests an urgent need for comprehensive vestibular assessment. When Robert Chen, a 73-year-old retired engineer, finally sought help for his progressive balance problems, he expected a complex medical journey. Instead, his diagnosis, benign paroxysmal positional vertigo, BPPV, led to a treatment so simple yet effective it seemed almost miraculous. The doctor had me lie down and moved my head through a specific sequence of positions. The whole thing took maybe 5 minutes, Robert recalls. By that evening, the vertigo that had plagued me for months was gone completely. This treatment, called the Epley maneuver, represents one of medicine's most efficient interventions. For BPPV, which accounts for nearly 40% of vestibular disorders in seniors, this simple, non-invasive procedure repositions the displaced calcium crystals in the inner ear, often resolving symptoms immediately. Research shows success rates exceeding 80% with a single treatment and approaching 95% with repeated applications if needed. For Grace Williams, a 68-year-old former preschool teacher living on Social Security, the Epley maneuver provided immediate relief from vertigo but didn't fully resolve her general unsteadiness. Her treatment continued with vestibular rehabilitation therapy, VRT, a specialized form of physical therapy that essentially retrains the balance system through progressive exercises. I started with simple head movements while seated, then gradually advanced to more challenging balance tasks, Grace explains. Within 3 weeks, I noticed significant improvement. After 8 weeks, I felt more stable than I had in years. VRT works by promoting central compensation, essentially helping the brain adapt to altered vestibular input. Research demonstrates its effectiveness across virtually all vestibular disorders, with improvements in balance, gait, and fall risk reduction in compliant patients. Unlike many medical interventions, VRT becomes more effective with age, as the brain's compensatory abilities remain robust well into advanced years. For vestibular issues related to circulation problems, common in seniors with diabetes, heart disease, or hypertension, medical management of the underlying condition often dramatically improves balance symptoms. This was the case for Victor Ramirez, a 71-year-old retired factory worker with poorly controlled diabetes. Once my doctor adjusted my medications and my blood sugar stabilized, about half of my dizziness resolved, he reports. His remaining symptoms responded well to vestibular rehabilitation exercises. When medication side effects contribute to balance problems, a factor in nearly 30% of senior dizziness cases, medication adjustment or substitution can create substantial improvement. Henry Chang, 75, discovered his blood pressure medication was a major contributor to his unsteadiness. My doctor switched me to a different drug in the same class, and the difference was dramatic. For those with limited access to specialized care, research validates several self-management approaches that can supplement professional treatment. Tai Chi and similar movement practices show particular promise, reducing fall risk by up to 50% in consistent practitioners. Home exercise programs designed by vestibular professionals and performed consistently. A strategic use of appropriate walking aids to prevent falls while maintaining activity levels. Careful attention to fall-proofing home environments, particularly in bathrooms and stairways. A vision optimization through appropriate glasses and adequate lighting. Susan Martinez, a 67-year-old grandmother working part-time as a cashier to supplement her Social Security, couldn't afford extensive specialized therapy. Her primary care physician directed her to validated online resources with vestibular exercises she could perform at home. I did them faithfully every morning and evening, Susan reports. Within a month, I felt significantly more stable. The most encouraging aspect of vestibular treatment involves its timing. It's almost never too late to benefit. Martin Jefferson, an 84-year-old who had been experiencing progressive balance decline for nearly a decade, saw meaningful improvement after finally receiving proper diagnosis and treatment. I assumed that after so many years, nothing could help, he admits. I was wrong. I've regained confidence I thought was permanently lost. Dorothy Wilson sat in her doctor's office, a neatly folded list of symptoms in her hand. At 74, the retired schoolteacher had finally decided to address the dizziness she'd been experiencing for months. I was nervous about bringing it up, she admits. I thought the doctor might dismiss it as just aging or tell me nothing could be done. Instead, Dorothy's prepared approach led to prompt referral to a vestibular specialist, accurate diagnosis, and treatment that transformed her quality of life. Dorothy's experience highlights a crucial reality. How you communicate about vestibular symptoms significantly impacts the quality of care you receive. Vague complaints like, "I feel dizzy sometimes," may not trigger appropriate medical response. More specific descriptions provide the detailed information healthcare providers need to properly diagnose and treat vestibular conditions. Effective communication includes describing exactly when symptoms occur and what seems to trigger them, explaining how symptoms affect daily activities and independence, detailing any falls or near falls, even if they didn't cause injury, and mentioning cognitive effects like confusion or brain fog during dizzy episodes. Connecting symptoms to specific environments or activities. For Anthony Guzman, a 69-year-old former construction worker, this detailed approach made all the difference. My first doctor just told me to be careful and use a cane. When I switched doctors, I brought a daily log showing exactly when my symptoms happened and what I was doing. That specific information led to proper testing, accurate diagnosis, and treatment that worked. If initial medical consultation doesn't yield satisfactory answers, persistence becomes essential. Martha Wilson, 76, encountered 3 healthcare providers before finding one who recognized her symptoms as vestibular neuritis rather than just aging. Her persistence eventually connected her with appropriate treatment that significantly improved her balance and eliminated her vertigo. For long-term management, understanding that vestibular health requires ongoing attention helps maintain improvements gained through treatment. William Johnson, a 78-year-old retired teacher who successfully overcame severe BPPV, maintains his vestibular health through daily balance exercises. I spend about 5 minutes each morning doing the simple exercises my therapist taught me, he explains. It's like brushing my teeth, just part of my routine now. This preventive approach proves particularly important because vestibular disorders often recur. BPPV, for instance, returns in approximately 40% of treated patients within 5 years. Those practicing maintenance exercises experience fewer recurrences and recognize symptoms earlier when they do return, allowing prompt intervention before falls occur. If you're finding this information valuable, please take a moment to subscribe to our channel. We share new, potentially life-changing content every day, and your support helps us reach more people who need these solutions. The journey to better balance begins with recognition, acknowledging that vestibular symptoms are serious medical issues, not inevitable consequences of aging. It continues with proper diagnosis and treatment, which dramatically reduce fall risk while improving quality of life. And it extends through ongoing management that maintains these gains while preventing recurrence. For the millions of seniors currently experiencing undiagnosed vestibular symptoms, this information offers a clear path forward. Unlike many aspects of aging, vestibular disorders respond remarkably well to appropriate intervention, often with immediate and substantial improvement. The key question isn't whether treatment will help, but whether seniors will recognize their symptoms as deserving medical attention before a catastrophic fall occurs. Remember Ray Jenkins from the beginning of our story? His fall and subsequent death might have been prevented by a simple medical intervention that would have taken less than 30 minutes. Don't let this be your story or the story of someone you love. Dizziness, vertigo, and unsteadiness are never normal parts of aging. They're warning signs deserving prompt medical attention. Please share your thoughts in the comments if you've experienced something like this. Your story could help someone else realize they're not alone. Don't forget to like, subscribe, and hit the bell icon to get notified when our next video goes live.